if we're doing all of those things, or if we can't identify any sort of bladder irritants and the symptoms are still present, then we start talking about medications. So the first line medication are typically anticholinergics. The first one that people are often prescribed is called oxybutynin, or Ditropan is the brand name. This works well to relax the bladder muscle, but it tends to have a lot of side effects. Constipation, dry eyes, dry mouth, and in some elderly patients can cause some cognitive dysfunction. So a lot of people hate that medication and they end up stopping to take it. There are other medications in the anticholinergic family that don't have the cognitive potential side effects, like 𝐉𝐨𝐻𝐿, and we use these sometimes too. But then there are a whole separate family of medications that are not anticholinergic. They're called beta-3 agonists, like mirabegron or Myrbetriq is the brand name. And this is a great medication, works well to relax the bladder, and it doesn't have any of those side effects: constipation, dry eyes, dry mouth, cognitive dysfunction. It can, in a small percentage of patients, increase blood pressure, but as long as you're monitoring that, that's not really an issue for most people. The biggest issue with mirabegron or Myrbetriq is that this is a newer family of medications, and it's more expensive, and oftentimes the insurance companies don't want to cover it unless the patient has tried one or multiple of the other types of less expensive medications. So if you can afford it, or if your insurance covers it, I would go straight to the mirabegron or Myrbetriq and not even mess around with the anticholinergics. But for some people, you need to start with the anticholinergics before the insurance will cover the other medications. Now, if the pills are not working, whether it's the anticholinergics or the beta-3 agonists, then the next line is Botox. And that's a Botox injection directly into the bladder muscle. And Botox is the medication that people typically use for wrinkles. It's basically a muscle relaxing medication, or a paralytic essentially. And it can be injected into the bladder muscle through a camera, and that can be done with an awake patient if they can tolerate it, and most patients can. With a camera in the bladder, we basically inject the medication into the bladder muscle, and that's very effective to relax the muscle and have less of these overactive symptoms. There's several downsides to doing that. One is, just like the Botox that you would do for cosmetic purposes, it wears off. It varies, but about 6 months it tends to wear off. And some people come back and they get this injection every 6 months, and if they can tolerate doing it in the clinic, it's a quick and easy procedure, and if it gives them 6 months of relief, then it's worth it to continue doing it. The other factor is that it's a procedure, and all procedures have some risks, even if they're low. So there's a risk of infection, urinary tract infection, or UTI, anytime you put a camera into the bladder. If that does happen, it's typically just a simple bladder infection that just requires 5 days of antibiotics and it will go away. There's a risk of bleeding. We have to poke into the bladder muscle to inject the medication. We watch afterwards to make sure there's no bleeding, and if there is, we just sort of buzz the area that's bleeding and make it stop. But there's always a risk that some bleeding we missed, or it pops up later and can cause blood in the urine. Typically resolves on its own, but if it's serious, then patients end up in the emergency room and have to have that dealt with. Very uncommon, but it's possible. The other one that patients definitely need to be counseled about if they're going to get bladder Botox is the possibility for urinary retention. Basically meaning that the injection or the medication worked too well at paralyzing the bladder muscle, and now the bladder is not contracting enough to get the urine out. This does happen in 2 to 3% of patients. It's self-limiting, meaning it goes away on its own. But in the meantime, we can't have you walking around with a full bladder for a week. So you have to have a catheter put in, or you have to do intermittent catheterization. So while most patients never have to have a catheter put in with this procedure, they all have to be willing to have a catheter put in the event that they do develop urinary retention. So that's why we sort of save the Botox injections to be the last line of treatment. But overall, overactive bladder is a symptom complex that it often tends to be related to dietary and lifestyle factors. But if those aren't working, then there are medications. If the medications aren't working, or if there's side effects, then there's Botox injections. And between those things, we can get 99% of patients feeling better.